always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaste. Welcome to Health Hour powered by Apollo 24/7. ఏం టైమ్స్లో ఉన్నామండి ప్రస్తుతం ఉన్న పాండమిక్లో అందరం కూడా ఒక భయంతో వేర్ at home. We are all restricted to our homes and we are worried. We are not stepping out, we are taking care of our elderly and we are looking and seeking for information. At this time, I think my priority from my home becomes accessing good medical care or medical assistance. I trust Apollo 24/7 for bringing 7,000 doctors together, 30,000 healthcare professionals together into my palm. I think I'm more empowered today. I'm feeling more safe. I'm feeling more protected today because I have power of the information. And that's where Apollo 24/7 thought that we should all come, connect and address these issues. No fear, no panic, information is power. So we thought we'll give you right information from the experts. Today on the Health Hour, we're going to talk about child health in the pandemic. We're going to have our experts. We're going to have doctors speaking to you. We're going to take questions from you directly. We're going to answer your queries. We understand your concerns. And also, I'm going to give you some wonderful prizes away. There are a lot of discount coupons and vouchers. There's going to be a quiz. You can participate and win. So, all set, let's start. మొదలు పెట్టే ముందండి ఒక విషయం చెప్పాలి. ఏమంటే ఆ రోజుల్లో రాణి ఆఫ్ ఝాన్సీ లక్ష్మీబాయి యుద్ధానికి వెళ్ళేటప్పుడు ఆవిడ రక్షణ కోసం చేతిలో కత్తి పట్టుకెళ్ళేదంట. మరి ఈ రోజుల్లో ప్రస్తుతం మనం ఉన్న టైంలో ఈ ఝాన్సీ రాణి ఏం చేస్తుందో తెలుసా? యుద్ధానికి వెళ్ళేటప్పుడు ఒట్టి చేతులతో వెళ్ళకూడదు షేర్ ఖాన్. నేను కూడా రైట్ ప్రోడక్ట్ ని తీసుకుని బయటకు వెళ్తున్నాను. ఈ ఝాన్సీ రాణి చేతిలో ఉంది డిస్ఇన్ఫెక్టెంట్ స్ప్రే. దీని వల్ల చాలా లాభాలు ఉన్నాయి, మనందరికీ తెలుసు, నేను కొత్తగా చెప్పక్కర్లేదు. ఆల్ అదర్ హైజీన్ పారామీటర్స్ తో పాటు డిస్ఇన్ఫెక్టెంట్ స్ప్రే కూడా మీకు ఉపయోగపడుతుంది. అది ఎలాగో చిన్న వీడియోలో చూపిస్తా చూడండి. కెన్ యూ హావ్ ద ఏవీ ప్లీజ్?
Here's how long the coronavirus will last on surfaces and how to disinfect those surfaces. Paper material, 24 hours. Fabric, 24 hours. Glass surfaces, 4 days. Copper, 4 hours. Plastic and stainless steel, 72 hours. Disinfecting surfaces is the primary way of controlling the spread of virus. At Apollo hospitals, we use multi-surface disinfectant spray. It's the most convenient and safest way of disinfecting surfaces.
తప్పనిసరిగా ఆయుధం పట్టుకుని వెళ్ళాలి. మరి ఈ రోజుల్లో తల్లులందరూ కూడా యుద్ధం చేస్తున్నారు పిల్లల ఆరోగ్యం కోసం. సో ఎవ్రీ మదర్ హ్యాస్ దిస్ కరోనా యాంటీ కరోనా ప్రొడక్ట్స్ ని వాళ్ళ ఆయుధంగా వాడుతున్నారు. If you're concerned about your child health as a parent, here we are bringing you experts to talk to you. Today we're going to talk about child health, and I have an expert pediatrician, senior pediatrician consultant from Apollo Hospital, Jubilee Hills, Hyderabad. We have Dr. Sreedhar garu. Sreedhar garu is an MD fellowship in pediatric emergency chesaru. He's handled a lot of intensive care emergencies, and I think more than 300 people, patients ni ippudu unna time lo aina online Apollo 24/7 lo consult chesaru. Good morning, Dr. garu. How are you andi?
Very good morning. I am fine. How are you?
బాగున్నామండి. అదే ప్రస్తుతం అందరం బాగున్నాం అనే మాట కొంచెం బెంగగా చెప్పాల్సి వస్తుంది, బట్ స్టిల్ థ్యాంక్ యూ సో మచ్ అండి. అందరికి ఒకటే క్వశ్చన్ డాక్టర్ గారు. ఈ రోజు నేను ఇక్కడ కూర్చుంటే మా ఆడియన్స్ అక్కడ చాలా మంది కూర్చున్నారు కదా, వాళ్ళందరి బదులు కూడా అడుగుతాను. మై ఫస్ట్ క్వశ్చన్ విల్ బి, how safe are our children in this COVID time, and what is the risk that children face?
Okay, yeah. See, nowadays, if you take it from the pandemic time, actually it was started on March. Okay, we know that when it's coronavirus, nobody knows about this virus. It's a new virus, and it's a pandemic started from 3 months. It's almost 3 months is over now. It's day by day is increasing the cases. It's not decreasing. Day by day is keep on increasing. విజృంభణలా ఉంది మీరు చెప్పినట్టు. దట్ ఈస్ వెరీ వెరీ కరెక్ట్ అండి. సో చాలా కేసెస్ ఎక్కువ అవుతున్నాయి. దట్ టు కమ్యూనిటీ స్ప్రెడ్ కూడా చెప్తున్నారు, బట్ నాట్ ఎట్ కన్ఫర్మ్డ్ సార్. దట్స్ ఓన్లీ థింగ్. ఓన్లీ థింగ్ ఈస్ కేసెస్ ఆర్ ఇంక్రీజ్ అవుతున్నాయంటే ఫ్రమ్ వన్ ఈస్ దే ఆర్ గోయింగ్ అవుట్. సపోజ్ ఇఫ్ యూ టేక్ వన్ పేరెంట్స్, ఇఫ్ యూ టేక్ వన్ హోమ్, సపోజ్ ఫైవ్ ఫ్యామిలీ మెంబర్స్, దే ఆర్ వర్కింగ్ or they have to go to outside to get all the things and something, they'll get the this coronavirus disease. We don't know how it is spreading. Only through droplet and coughing and sneezing you will get that infection. We don't know. Some are using mask nowadays, since some are not using mask. So కొంతమంది యూజ్ చేయట్లేదు. దట్స్ వై వాళ్ళు ఇంటికి వచ్చినప్పుడు they'll get that ఆ డిసీజ్ వాళ్ళకి ఆటోమేటిక్గా చిల్డ్రన్స్కి వెళ్ళిపోతుంది. సో దే ఆర్ మెయిన్ క్యారియర్స్ నౌ. So children are at home only. Now lockdown period, nobody is going out. Correct. But they are giving that one disease to the children.
Okay. So pillaki enta risk undantaru? Are children very badly affected by this disease, or vallaki emaina life threat lantidi untunda?
Exactly. Luckily not like other respiratory infections. We know that one swine flu, H1N1. It's very very dangerous. Less than 2 years or less than 5 years childs, okay, even less than 10 years and more than 65 years. So very very dangerous that one. It's life threatening also sometimes. But it's not like that. It's coronavirus I'm seeing, and but in India, in Telangana, we are getting very less cases. But if cases are positive, all are 95% are asymptomatic. They are not getting any simple cough, cold, and simple flu only. They are getting the symptoms. And it's going. That's only good thing, because of why means that normally this coronavirus go and anchor in that lung tissues and lung cells. That's through ACE2 receptors. That receptors are not well developed in the pediatrics populations.
So ఏ వయసు అంటారు ఇప్పుడు ఈ ఏస్ రిసెప్టార్స్ మీరు అంటున్నారు కదండి, చైల్డ్ అంటే నేను ఏజ్ నుంచి తీసుకోవాలి, రిస్క్ ఎవరికి లేదని అనుకోవాలి
అంటే so far see this nobody knows that one who are getting more less than 10 years we are taking that very 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 less effective.
So less than 10-year children unte they are like better, they perform better, వాళ్ళకి రిస్క్ తక్కువ ఉంది అని మనం అనుకోవాలి
compared to swine flu if you take it. So yeah, swine flu, if you get me, definitely it's going to be hospitalized, they need to nebulizations. But this is more or asymptomatic, because I am getting online consultations, so many things. Parents are positive, right. Baby is asymptomatic. They have checked the baby, it's came positive, but it's very fine. Nothing, no symptoms at all.
థ్యాంక్ యూ డాక్టర్ గారు అష్యూరెన్స్ ఇచ్చినందుకు. అండ్ ఈ యూట్యూబ్ లైవ్ చూస్తున్న వాళ్ళు మీకు కూడా దీనికి సంబంధించి ఏమైనా డౌట్స్ అండ్ క్వశ్చన్స్ ఉంటే ప్లీజ్ గో ఆన్ టైప్ యువర్ క్వశ్చన్ ఇన్ ద చాట్ బాక్స్. నేను లైవ్ చూసి మీ క్వశ్చన్ వెంటనే డాక్టర్ గారికి అడ్రస్ చేస్తాను. సో గో అహెడ్, టైప్ యువర్ క్వెరీ అండ్ క్వశ్చన్. సో డాక్టర్ గారు, మీరు ఇందాక చైల్డ్ మదర్ టు చైల్డ్ ట్రాన్స్మిషన్ గురించి మాట్లాడుతున్నారు కాబట్టి, వాట్స్ ద రిస్క్ ఆఫ్ బ్రెస్ట్ ఫీడింగ్ అ చైల్డ్ ఇఫ్ ది మదర్ ఇస్ అ పాజిటివ్, అండ్ I'm worried if the child will also contract the virus from me.
Yeah,
breastfeeding chuttu unna apohal gurinchi cheptaru.
That's good question. So for WHO decides and some articles from BMJ and the Lancet, all the things, so many came and they have studied with that one. Through breast milk, it's not spreading. So they have tested with the mother milk. So coronavirus is not spreading through the breast milk. Even if mother is COVID positive, you need to give. There is no contraindications, but with specific precautions like that one, face mask, and complete. You need to wash your hands. You need to touch the baby with a properly disinfectant. You need to wash your hands and something. After that only, you can give the feed. Even otherwise, if you are more worrying, it's suppose viral load is high. If mother is sick or something, then you need to express and give.
Okay. So మార్గం అయితే ఉంది.
ఖచ్చితంగా
Do
ఇవ్వచ్చు.
not stop from breastfeeding.
No.
వస్తుందేమో పిల్లలకి అనే భయంతో పాలు ఇవ్వడం ఆపకుండా కంటిన్యూ చేయండి.
Exactly.
జాగ్రత్తలు తీసుకుని కంటిన్యూ చేయండి.
కంటిన్యూ చేయొచ్చు.
యా, ఇంకొక నెక్స్ట్ క్వశ్చన్ ఏమొస్తుందంటే, one of my friend's sister called up and said, vaccination का schedule अभी चल रहा है उनका. Now I need to give the vaccination to the child. पर कैसे जाऊं घर से बाहर? Can I take a pause here? Do I stop the vaccinations? Schedule ఏమన్నా ఆపచ్చా?
No. So WHO and ICMR, our ICMR guidelines also is telling that. So vaccination, you are thinking that people doesn't know about that vaccination. Normally immunity, people are thinking about immunity nowadays. They are asking about only medicines through immunity.
Mm-hmm.
But vaccination also is a part of immunity. So
Right.
you are more protective than 15 to 20 diseases. So if you give that one, so very dangerous disease if you are more protective. So that is one type of immunity. So that's why you need to give. You have to give. You should to give. అంటే మీకు ఖచ్చితంగా ఇవ్వాలి, ఎందుకంటే
ఇవ్వాల్సిందే. సో వ్యాక్సిన్ ఇంకా నేను ప్రస్తుతం లాక్డౌన్ లో ఉన్నాను, యాక్సెస్ లేదు అనుకుని ఆపడానికి వీల్లేదు.
బట్ ఓన్లీ వన్ థింగ్, ఆపడానికి వీల్లేదు. ఎస్పెషల్లీ దట్స్ డివిజన్ ఉంటుందండి. ఇట్స్ ఇఫ్ యూ టేక్ ఇట్ primary vaccines less than 1 year, you need to take it without any delay. And suppose all our Apollo clinics are giving, all our doctors are giving. If you come to everywhere, please we will give it to that one vaccinations everywhere.
Okay.
Booster vaccines you can postpone it. Booster vaccines. Booster vaccines.
అవి కూడా ఎంత వరకు పోస్ట్పోన్?
Maximum 1 or 2 months you can postpone it. Nowadays, even only completely, if you want to postpone it, 2 vaccines can be possible: hepatitis A and HPV. So through that, the 2 vaccines you can. Other than things, you can just postpone it, but 1 or 2 months, and that's all. After the treatment.
So now coming to slightly grown-up children's health అండి. వీళ్ళకి మనం ఇమ్యూనిటీ పెంచాలి, న్యూట్రిషన్, మంచి న్యూట్రిషన్ ఇవ్వాలి, ఇవన్నీ తల్లిదండ్రులుగా we all keep talking. We are all concerned about child health. So our priority becomes giving good food. There's so much of buzz about nutrition supplements, so much of buzz about the DHA supplementation. Do you think the DHA will improve IQ, and do I need to give supplementation to my child?
Exactly. So that is also a good question. So DHA is ideally is yet to be approved, but some articles, some publications, and some companies are showing that it's increasing IQ. So on such particular age, so normally less than 2 years, that 1,000 days. 1,000 days is more important than if you take it pregnancy period. After that total period, if you calculate, that is 1,000 days is brain development will be there total. So that 1,000 days, if you take it first year 365 days, second year 365 days, and pregnancy time, total is 1,000 days. So brain development 95% will be the 1,000 days only total. In that time, ideally, so the DHA supplements, if you give that, IQ will develop. That the studies are telling, but only thing is naturally occurring the DHA supplements like walnuts. If you take mother is walnuts and flax seeds, chia seeds. If you are a non-vegetarian, you will get with the salmon fish. So many supplements are coming, but you can give. But DHA, not only plain DHA with ARA combination. It's 0.34% DHA and 0.62% of air. So many powders will be there. You can give it to that.
So that is again only on prescription,
Exactly.
not like store-bought, self-taught kaadu.
Yeah, so many are selling DHA drops also. You should not buy. You just ask me, and you just ask any thing. Then only pediatricians can suggest, yes, really, if this child is really requires or not. If
Yeah.
developmentally fine, and if growth is fine, then no need that one.
All right. So, Dr. Garu, just one more question before I will see you again with a lot of questions. I can see there are a lot of questions here. YouTube chat lo chala mandi questions chestu unnaru. Yeah, but especially people who are saying why only in Telugu. I think we are switching
Very
in
good.
and out of Telugu, English, Hindi. हम तो सारे languages में आपके लिए answer करेंगे. आप जो भी language समझना चाहेंगे, we are trying to repeat.
Definitely.
తెలుగు నుంచి కూడా
Telugu
చాలా మంది ఉన్నారు కాబట్టి we
English
will try and do everything. Okay. So yeah. So supplementation గురించి మనం మాట్లాడేసుకున్నామండి. How do I take care of the mental health right now in the lockdown? The children are not going out to school. They are not going out to play. And ఇందాక మీరు చెప్పినట్టు children పెద్ద రిస్క్ లో లేరు అనుకున్నప్పుడు why can't I let them go out and play when they are not at major risk?
See, only thing is if you go and play outside, so you will be the carrier. We don't know who is having. I told you about that one. Asymptomatic patients nowadays keep on increasing. If you take 1,000 patients, in that 65% are asymptomatic. Only 30% are mild symptoms and more. Only 1 to 5% are going to be sick. Other than that, so asymptomatic patients, we don't know. If kids are going out and playing with other kids, we don't know. They'll get వాళ్ళకి వచ్చే ఛాన్స్ చాలా ఎక్కువ ఉంటుంది.
Right.
They're the carriers. That's why you have to
take care of
them
they
at
don't
home
have
only.
Yes, very important point. Dr. Sreedhar garu, I want you to wait for a little more while because మీరు symptoms gurinchi right now you gave us a very important point. At this point, I would want you to hold on. Guys, if you have known that, if you have seen that Apollo 24/7 and Apollo hospitals have come up with a COVID scanner, which is amazing as a product where you can just type your symptoms. 15 million people have typed in, checked if they are at risk or not. Now to the next level, you can check your symptoms directly with artificial intelligence. And we are going to launch an amazing product today here in this health hour. And I have Dr. Neetal Vijay Sen joining us very shortly. Dr. Neetal Vijay Sen, who's an MBBS doctor, who's DGM operations at Apollo 24/7. Dr. Neetal, your cough says everything about your health is today's motto. So can I, hello sir, how are you?
Morning, Ms Jhansi, and good morning, everybody.
Good
morning, all participants and staff. Yes, it's wonderful to be here, Ms Jhansi. Yeah.
Thank you so much, Neetal. And this is so exciting. 15 million people have just checked their symptoms because you need to be assured before you go out and get yourself tested. And now you're taking it to a next level. If I just cough and it says all, how is this possible? And can you please tell us what is this cough scanner?
Yes, absolutely. So we've seen that cough seems to be the most common and worrisome symptom, and it manifests itself in conjunction with so many other symptoms. So we say daggu jaram, daggu sardi. We don't say jaram daggu, right? So cough comes first, and it's the most symptom that we have. And today, either we have cough for a very simple allergy, or due to pollution, or just a very trivial reason, or even a seasonal flu. Our minds converge towards COVID today, isn't it? So while we have a very, very informative link to speak to a doctor, like you said, around the clock for any queries on COVID, which is an AI-driven chatbot for COVID risk assessment, which close to 15 million people have taken the scan. And also, while you're at home, while you're at work or elsewhere, anywhere, all while waiting to speak to an Apollo specialist, you've been coughing. You don't know what to do. But now, you can actually self-assess through this very interesting AI-driven cough scan, which is a risk assessment tool that makes you aware of your health, your condition in these difficult and confusing times. So,
and how do I cough? Like, do I send my sample somewhere, or how do I actually do this test?
I'm glad you asked this question before I came in there. So it's a very simple tool. I will demonstrate you how it's to be done. You can just do it yourself while I'm demonstrating with everybody else.
Okay.
So presenting you a very, very interesting and AI-driven tool, cough risk scan test. Please check this out.
And do I need to do it live here?
Yes.
Okay.
I'm just showing it to you. You can actually cough and see how it works.
Okay.
I'm sure a lot of people can see what I've displayed here. So this is a cough-scan.apollo247.com. All you have to do is just put this link there and click this link. This page opens up. You choose your language and you only cough now.
Okay. I'm coughing now.
Button. Yeah. 10 seconds. Yes.
Okay.
You're healthy. There's no cough. I can see that you're totally healthy. And I just submit it, and it takes me to a page where it asks me my age.
Do I need to tell my age right here? I don't want to.
No, you don't need to tell out because it's a private, tool. Everything is secure. It's a private. We maintain privacy.
Yes.
Totally confidential. You don't need to worry about somebody checking.
You're not sharing this with my Aadhaar number or nothing is linked with
nothing. This is the data which entails us, which gives us hope that we can actually, collect this data and aim towards prevention of COVID in some way or the other, because the data is very important and the tool learns itself. It's a artificially driven tool. It's called machine learning. It learns itself and takes information and keeps giving us inputs. These many people have taken the test. This is what has happened.
Yeah. So I have to cough and then answer these questions one after one. Okay.
Absolutely. Yes.
Yeah. So that's it.
Your age and gender, it's just a few seconds it takes. And your temperature, whatever, your temperature, that's right. And are you experiencing any of the symptoms? Let's say dry cough, for example. And moderate to, or it'll now ask you, do you have any other experiencing symptoms below? So we have to mark it accordingly.
Okay.
Yeah. We would like to know about your smoking history. Okay. Let's say I'm a current smoker, no travel history. It asks you, have you traveled recently? Yeah.
Yes. And how safe is this to share my information? It's all confidential.
Totally secure. Totally secure. There's no name. You're not giving a name here, right? Just assessing yourself. But this data collects in our backend without any information of yours. And we use this data to come to a conclusion of how to navigate through precautions to preventive modes of these disease patterns. But that's very important.
Right.
So this is how I'm just going fast because...
I know. We can see the...
result. I'll show you the result.
Yeah. So all these questions, once you say yes...
This is just a few seconds. Just a yes or no that you have to click, and it's so easy.
Yes.
And it analyzes now. You can see that it's analyzing now and gives you very medium, because I've selected a few positive points. So it says medium respiratory illness.
Okay.
Your cough pattern is normal because what you coughed seems totally normal. Yeah, it actually analyzes your cough. If you have phlegm, it analyzes that part too.
Okay.
Right. So this pattern of accepting your cough sound impulse into the app and understanding what type of a pattern you cough is very important.
So it also tells me, where do I consult? Do I need to consult?
Yes. It says, okay, you can go for a consult with a doctor for prevention and precautions. You can go through the instructions below. And for laboratory tests and imaging, maybe you can check with your doctor and all these things and order your Corona care products. So you can actually order a kit to your house, looking at what precautions you need to take, what devices can come in, and activities like that. So simple as this, that you scan, do a risk assessment, you know what your health status is right.
Very interesting. Just less than 30 seconds that I can assess my risk. Where do I find this, Dr. Neethal? How can
This is a very, very simple website I just talked about. You can just type in cough-scan.apollo247.com. Done. You put that on your website, click it, it gives you a tool.
Okay. So I can see it on the screen right now.
There you can see.
You can, yes. And also on the Apollo 24/7 YouTube channel, as well as website or other social media, you will be able to find this. Yeah.
Absolutely.
Right. Wonderful.
So I think we're presenting to the participants and everybody today. Please do this. Please test yourself. Do not get anxious and be safe. Thank you.
Great. Dr. Neethal, just one more thing before we conclude.
Yes.
I saw that you were saying that if I have any symptoms or if I am at risk and if I need to consult a doctor, I see that you said that you have certain Corona products and then you also have a package called Corona Kavach. What is this? Can you please let me know?
Well, so you brought out the best in what we have today. Today, when we talk about people being affected here and there, people wanting to know what to do in case you have symptoms, in case you have suspicion that you might have attracted some kind of a virus. It could be just flu, but it could be anything else also. So you could choose to isolate yourself and order these sets of products at your doorstep, right? So all you have to do is go onto the app, Corona Products, and you call us on the helpline that we provide you, and you get delivered these products to your house.
Okay, that's interesting. So the kit is available on Apollo 24/7 app as well. Yep. Okay, so would you want to brief us what the Kavach program is?
Yeah. So what we have today is a lot of people are apprehensive. Do I have COVID? I have a scratch in my back. Do I have COVID? I have cough. Do I have COVID? Every related symptom or every unrelated symptom brings you to a notion of, do I have COVID? Right. Mm-hmm. So now somebody who's been exposed to people who have COVID or somebody who's not had symptoms,
right?
What do they need to do today? They wish to isolate themselves at home or in a hotel that we've tied up with. Apollo is tied up with a few hotels through the country. And there's a helpline that we bring you to, and you can call that helpline and just register yourself to isolate yourself at home and in the hospital, in the hotel. Now, what happens when you're isolated? Somebody has to take care of you, right? So we have a dedicated nurse around the clock, a dedicated doctor around the clock for you to speak with them in these times of anxiety moments for you at home or in the hotel. There's a dedicated nurse sitting at the hotel only for you to talk to them whenever they need, right?
Right.
So
right.
all you need is that you need to talk to somebody, take help, seek help. I have cough. What do I do now? Talk to the doctor. He's available right there.
Okay, right.
So Kavach, Apollo Kavach program gives you that leverage.
Lot more on Apollo Kavach. I'll get back to you, Dr. Nikhil. But right now, I have a lot of questions. Intamandi questions adugutunnarante.
Yeah, I can see that.
Yeah. So a lot of doubts, your queries, all of these here. Dr. Sreedhar Garu, can we have you back on the screen, Andi? So I have Dr. Nikhil and Dr. Sreedhar here, both of them. Chala questions adugutunnarandi. So there's Rajesh Thakur, Praveen, Malli, a lot of Sushma Devi. Similar questions I'm going to club into one and ask. Sushma Devi Garu has asked that son is 11 months old. He slept mostly, but improve his sleeping time. And somebody is saying that children are unable to eat well. So babies are not eating well. Then somebody, Mayuri Sadhana, good morning, Dr. Garu. My question is 4 years baby. Can I supplement with vitamin serum and colostrum capsules to improve immune system?
Yeah. Okay. Yes. Two questions you clubbed. One thing is sleeping. So normal sleeping pattern is for any children is minimum is 8 hours. Okay. Nowadays is that's first question. His answer is 8 hours. If you give that gadgets and screen time is more, nowadays they are at home, they are playing all the time with the iPads and mobile phones. So they are delaying that sleep pattern. That's very dangerous. You please tell them to sleep at least 8 hours per day. That's question.
Okay, done. So there's another question in the 4-year-old gastric problem. Even while sleeping, she's passing gas. Is it due to water, or do I need to do something about it?
So gastric problem.
Gaurav Mittal. Yeah.
Hi, Gaurav Mittal. Yeah.
English or Hindi mein answer kijiye, please.
Okay, English. So only thing is, see, that's there's passing gas means you need to evaluate first. So one thing is, what food are you giving? Is it spicy, masala, or oily foods or something? First part is, diet. And second thing is how he's doing. Means he is doing a daily exercises because of they are at home now during lockdown period. So you need to do some exercise. Otherwise, if you take it, it can't digest. So that will pass on that one. So only thing is we need to evaluate that child if he's having abdominal pain, vomiting, loose motion, something. So definitely we will tell you that so many symptoms and signs along with that one. Based on that one, we have to treat it.
Yeah. Doctor, there's another question, pediatric question here. Mr. Anant Narayan, 2-year-old child is having fever and cough and cold. What are the preventive medicines I need to keep at home?
Just to intervene, sorry, Dr. Sudhi. I think there are a lot of questions I was looking at require a consultation. answers that doctor may give. So we will have to have a consultation with the doctor. We could always go ahead and answer general queries and information.
That is important. Yes, such questions definitely they will have to download Apollo 24/7 app. It's an easy. They can consult the doctor there. Yeah, but randomly, there's this vitamin C. Can it be given to children?
See, randomly you should not give to the vitamin C to the children, because if it's naturally we are getting. So like citrus fruits, so many things is there, broccoli, okay, orange, strawberries, so many fruits are there. So you please need to take it naturally. Why you want to go to that supplements?
Yeah.
No need to give. There is no recommendations. Only recommendations previously asked one question someone is like vitamin D. Okay. So vitamin D supplementations you can give colic calcium. Other than that, we are not giving any supplementations to the other vitamins. We should not give.
Right. So there are a lot of other questions which are considering that cough and cold hai 6 months se lekar 4 saal ke bachon ke andar. There are a lot of people who are asking, is this something to panic? Cough and cold in children. Is it related to COVID?
Exactly. So nowadays we cannot differentiate between the COVID and other flus, but only milder things. Some are common flu, swine flu, and so many respiratory syncytial virus. So many infections are there. Compared to that one, COVID is have special symptoms like they'll get cough, cold, and if it is older children's headache, and atypical symptoms also nowadays we are seeing like skin rash, conjunctivitis, and diarrhea, vomiting, abdominal pain. So many are there. So it's keep on increasing now. Cases are very, very high. So we cannot differentiate straight away like that. We have to assess the baby and whom are they contacted with any COVID? Are they traveled from any travel history is there? Are they going to daily to the government officials and doctors are going daily to the hospitals and their institutes? So they are going who are going out and coming, bank employees. So we need to evaluate and tell that. We cannot conclude direct that is COVID. Classically, it is not COVID. It's really difficult.
Right. So basically, ilanti questions ఉన్న వాళ్ళు ఎవరన్నా definitely Apollo 24/7 లో risk ఎక్కువగా ఉంది అనుకున్న వాళ్ళు please download the app, consult the doctor. They'll be able to guide you much better because these are questions which need specific answers from the doctors. So Dr. Neethal, there's one question for you. Let me just, is Apollo treating COVID?
Yes, of course, we admit COVID patients, we evaluate them, assess them. We have COVID wards in a good number of hospitals through the country. We are, yes.
Yes, and also through, even before you reach Apollo, I think Apollo 24/7 is a better place to understand a cuff scanner or other scanners that you provided, and also consult the doctors. Absolutely. Is that a better way to approach, or you think that one should just walk into the hospital?
No, I would recommend. That's one of the reasons why I've given this help to all the people. Right? First, you have a doubt, you have some kind of a symptom, go assess yourself first, even before you speak with the doctor. Right? The scanner gives you kind of information that might be, taking you towards should you get a consult, should you get a test, and things like that. So it branches out, and then it tells you, okay, get a consult done. So then you go to Apollo 24/7 app, you consult with the doctor. Doctor writes a prescription, you get medicines delivered, and all that will happen, right? So I think it's a step-by-step pattern and not panic at all.
Right. Thank you so much for that assurance there. There's another question, pediatric question to Dr. Sreedhar Garu. Vasudha Rani is asking this question. Sir, due to COVID, my children are not exposed to sun. They're lacking with vitamin D. So what are the home remedies, and can I give vitamin D?
I'd say just wake them up early in the morning and say, go out. Don't be in the house.
Only thing is you should not go out, because if it's in the apartment there and they can't get that sunlight, sometimes if you get sunlight is early mornings is really good, and sometimes only thing is you need to supplement. I told you previously also, you need to supplement. There is no sun exposure nowadays, and almost 60 to 70% kids are getting vitamin D deficiencies during for the last 10 years. I'm seeing.
Yes.
So that's why we need to supplement. Definitely, it's drops will be available, syrup will be available based on age, 400 international to 800,000, and if it needs really deficiency, we need to give 60,000 international units.
So I can get myself tested. Diagnostics are also possible on Apollo 24/7 and consultation with you, especially Dr. Sreedhar.
Yeah.
Yeah, with
Totally.
all you.
Definitely, if you consult, that's those Apollo 24/7, and they will guide you all the things.
Correct. And yeah, premature babies ki edana risk untunda. Ashwini Jajala, that's one question. And the other question, Sreenu Kari, what to do when they are not taking steam, sir? Do children have to regularly take steam?
No, but you can give. That's only steam is not if they have any symptoms like cold and stuffy nose during that time only, not every day. Why you want to give every day unnecessarily? You should not give that one. If they have signs of stuffy nose, coryza, or upper respiratory tract infections and common cold, then you can give. And some babies will have chronic lung disease, those who are having cystic fibrosis or something, and they are chronic wheezers. Then you just take care of the child. You need to give that one. It's really good. Okay. So and preterms, it's not for every. Preterms means definitely risk is always less than 10 years, especially less than 1 year.
All right.
So COVID risk is definitely will be there, not only preterms. So you have to be very careful. That's
Okay. So yeah, there are a lot of other questions. I think as we go further, we will definitely take these. Just before I continue, there are a lot of people who are asking me that why I'm speaking in Telugu. Telugu is my mother tongue, and there are a lot of people who have joined from Telugu. And today's questions and today's quiz is region specific. I'm going to get to my quiz session. So I'm going to ask you questions, and this is only for people in Hyderabad. People in Hyderabad, get ready. I'm going to ask you a few quiz questions. If you give me the right answer, then you are going to win prizes. Yes. So I will switch in English. I'll switch to Hindi. I'll switch to Telugu. These are the three languages predominantly we are working. And people who require other languages, I think Telugu and Hindi and English will be able to solve your question. Yes.
Sorry, Ms Jhansi, I think the eligibility for this quiz that Ms Jhansi is holding is only for non-Apollo people. There are a lot of Apollo staff who's there. Please do not answer because you might already know the answer. So,
okay, done. Thank you so much for that, Dr. Neetal. So get ready for quiz. I'll quickly give you the rules of quiz. That non-Apollo staff only will have to participate. Only Hyderabad people will be able. You can participate just for your fun, but if in case you are the prize winner, then you will have to be from Hyderabad. And that's it. So shall we start? I'm going to give you 10 seconds or 15 seconds for each question. You type in the answer in the chat box, and that's it. These questions right now in the first round of quiz. The first question for today is, which is the largest organ in the body, in the human body? Am I clear? Which is the largest organ in the human body? Manava Sariramlo annitikante pedda avayavam edi. Largest avayavam edi. Sabse bada Manav Sharir.
Heart. Somebody says heart. Yeah, you got a big heart, Priyanka. That's fine.
Oh, do you really, doctor? Thank you so much. I have heart. Okay, somebody says skin. So let's see. I'll give you the answer in a few while. Come on, go into the chat box and type, and you might win. Next question I'm going to ask you is, how many bones are there in an adult human body? Manava Sariramlo enni yamakalu untai? Yeah? Question clear? I can see. Enni yamakalu untai? Okay, people are still answering for the first question.
I can see loads of answers there.
Oh my God, pancreas, Sunil Chandra. I don't think that's the right answer. What? Avayavam an adiganandi, organ. Sudarshan, thigh bone is not an organ, Sudarshan, please. Heart, okay. There are a lot of people who are saying 249 bones in human body. Where do I keep the extra ones?
640. Somebody said 640. God.
640?
Come on, guys.
Okay. 206.
The next man.
A lot of people are 206 to 3000. Save me. That's wrong answer, Dhiranai. That's a wrong answer.
Ms. Jhansi, don't you think it's so important for them to know their own body? How many organs do I have? Or how many bones? It's your own body. It's not about somebody else's, right?
True, Dr. Neetal. That's right. Interesting to see people, so many people participating in the quiz. Go on, next question coming up. Third question for this quiz round. It is, how many features are there in Apollo 24/7 app? How many features are there in Apollo 24/7 app? If you don't know, what you do is quickly download the app, see how many features are there. I'm going to give you time because I'm going to take the next break. Before I come back with the next quiz break, you can answer all these questions and then let's see who the winner is. Okay? So let me see if any answers have come in. Dr. Neetal, do you see any answers?
Yes,
For
yes, I
Sindhu Shah, you said 6. Anant Narayan said 4. All videos said 8.
So which means that they've actually seen, but they've kind of failed to count.
Yeah.
But we're happy that they actually went
says 10. So let's see which is the right answer in a while. Naveen 15, definitely not 5. Sahiti, sorry, not 4. Try. Keep trying.
So what we should do, I think we should give a gift to all of them because all of them are downloaded it.
That's interesting. Yeah. So please download, check how many features are there, and come back. Yeah, that's the quiz session number 1. Quiz winners will be announced towards the end of this, and not just that, everybody who's participating in this live, we are going to give you discount vouchers, we are going to give you coupons, so stay on till the time that we finish this live. Okay? So thank you so much, Dr. Sreedhar Garu. For more questions, I'll get back to you. Now, Dr. Neetal, let's continue with the features of Apollo 24/7 as we've been talking about it.
So in one line, if I would say, it's an end-to-end digital one-stop solution for customers, while we can actually seamlessly integrate with Apollo's physical network to provide a distinctive omni-channel, which aids continuum of care with an experienced specialist through the cloud. Anytime, anywhere, virtual consult with the Apollo certified doctor available in less than 15 minutes. Isn't that amazing? Now, this is what happens on the app. So you can consult a doctor from any time, any place, anywhere in the world, right?
Right.
And these doctor specialists who were never available for you are now available within 15 minutes. Like you would have stand in a line, you would have traveled from far off places. Now at a click of a button, you have these doctors available. Different specialties. There are some 50 to 60 specialists available. 6,000 specialists and 50 to 60 specialties, which means that you have the entire gamut on one single app, right? And then when these doctors consult you, they can consult with you on a chat. They can chat with you. They can do a video. They can do an audio and speak with you, right? The entire medical history is structured and archived inside the electronic medical record section, right? And the patient can actually go and upload his documents and keep it there in the medical vault. Also, when the doctor writes prescription, they can order medicines. These prescriptions are saved as an electronic medical record. You can access it anytime, lifetime, right? And you can order medicines from here. You can order diagnostic tests, which are very easy. At a click of a button, we will come to you and deliver medications. They come to you and do the diagnostic tests, deliver all these reports online, right? So you don't have to run anywhere, don't do anything, don't carry those heavy bags. You don't have to do that anymore, right? Also,
this is perfect for the COVID time, you know.
And COVID,
designed for COVID times.
Yeah. Because you're sitting at home, you don't know what to do. What do you do now? Go to the app. Take health. We feel and we believe that you should never fall sick, but in case ever there's a need, we are there for you. And for especially people who have chronic diseases like BP, sugar, and all those other diseases, we don't consult and let you go. Take these medicines and we forget about you. We engulf you. We counsel you. We're there for you 24/7 to tell you what to do to get better, to have an excellent quality of life, right? That entails us in a digital therapeutic condition management program, chronic disease management program, where we have 6 months, 1 year, 2 years programs for you, right? So you can rest be assured that a doctor is always with you, a counselor is always with you, someone is always with you on the hospital side, yeah? So that's what it does. So I think as a whole, you have a lot of information, a lot of data that is there, which is helping you get better, which is aiding the doctors in assessing your condition, checking your health trends through the electronic medical records, making sure you stay safe. That's what Apollo 24/7 does. So these are the features that we have. And 24/7 coronavirus helpline, you just dial the line, go into the app, click that link, you get connected to a doctor. Isn't that so easy, Ms. Jhansi?
That's sounding very easy, but in practicality, is it easy? Will you please take us through the...
Absolutely. I'm just waiting for that. I will take you
Yeah?
through the detail.
So
Yes.
how do I consult the doctor from my home?
You just have to download the Apollo 247 app on your phone, your Android or your iOS, and it's done. And I'll take you through the steps.
Okay. So once I have the app, you mean to say I can access all the features?
Absolutely.
through the
Absolutely.
app? Wow.
This is how it shows. Yeah.
This gives me power. Yeah.
So you go into the home page, click find the doctor. Is it for yourself or your family member? Select the specialty, select the doctor, click on consult, and actually pick a slot time through the day or through the night. Pay the consultation fee and answer a very few questions about your health, like your body weight, your height, your past medical history. And the specialist is on. The specialist starts chatting with you. This is the prescription. You can download the prescription and also the medications in that. That's what the app does. You can always find your medical records here. Go to the medical records section. All your past consults, your details. So this is a complete detailed program where you have one-stop shop to consult a doctor, to prescribe, to buy the prescribed medications and do the diagnostic tests at home.
Right. Wonderful, doctor. This is sounding very easy, and actually it is easy. And Dr. Neethal, there are a lot of other questions. I think there are two questions that we would want to take from Dr. Sreedhar before we get on to Apollo Kavach program. May I request Dr. Sreedhar Garu to come back? Sreedhar Garu, there's one important question that I think we need to answer here. Madhu is asking this question, Madhu Nanam. My cousin delivered twins 5 days back and rapid test confirmed positive mild symptoms of COVID. So how to make sure that the kids and other family members are not affected due to COVID?
Okay.
That is one. And also one more question I would post it to you and you can answer at your convenience. Anu Vijaya has asked a question here. Suggest food for kids during this season, sir. Oh, that is a longer answer. We'll come back to that question, sir. First to the twins question of Madhu.
So the twins both positive, no?
According
to the,
yes.
Okay.
Rapid test.
The rapid test, okay. So RT-PCR, that means and rapid antigen test. Two things are now they are doing. Okay. So it came positive means first no need to worry about that one where you have admitted and something without any. We have to that period will be the total 14 days of. Okay. So the total 14 days of period. Asymptomatic phase and symptomatic and decline phase will be there. So based on that one, only thing is you need to observe, you need to daily checking your vitals and heart rate, respiratory rate, and saturation is main important thing. Very important saturation, and any breathing difficulty and increase respiratory rate. So that neonatologist can take care of everything. So day by day, so we cannot say completely like everything is so phenomenal. It's whenever the symptoms will come, according to symptoms only we need to treat. There is no protocols for newborns and no medications, special medications for the things, common flu things, common drops, common things. That's all.
That's all. Mm-hmm. And that's interesting, doctor. And the food, nutrition is a lot of mothers and parents concerned that I can see. People are not eating, your children are not interested in eating. How can I give them nutrition and all?
See, it's a picky eaters will be there. So in everywhere, normally some kids are very, they used to fond of foods. They'll eat more because of this lockdown period. Some kids are picky eaters. So we need to select that who are the picky eaters. So they can't eat much. Only thing is in the children, we need to evaluate why. Why is not eating? And you need to check that growth also. Is weightage is normal, heightage is normal, and development is normal. So we need to evaluate the pediatrician. And you just ask me so many questions in the 24/7 Apollo app and something you can take consultation. Then we'll discuss a lot of things. So picky it is why? Because of he's not eating much, he's not eating vegetables, he's not eating fruit.
So Applo, we can discuss all of these, Andy. Will you be thinking that doctor time is very, very limited? Do you think that I can chat with my doctor?
Exactly. See, I'm 95% I'm calling to my all patients. I'm not charting more. Why means if we talk only, they'll be very comfortable. Not because of kids are very precious, you know that one. So they're thinking that if you talk only, they'll be very more comfortable. I have taken so far for the last 3 months more than 300 consultations throughout India. So
Through
I
the app.
through the app more than
Oh, that's
300.
really wonderful, doctor.
Thank you. So that's
Making
all.
sure that you're available through Apollo 24/7, and that is beyond your working hours. That is something really, really appreciable.
Exactly. So their counseling part is different. Counseling will be there, and you need to treat the things. When you have to go to the hospital, that also I tell you that warning signs.
Wonderful.
So many
Just one
things.
more question before I take leave from you, sir. Children with respiratory allergies are more prone to COVID. Is that's a question? And is pneumonia vaccine mandatory for children?
Exactly. Two questions. Very good questions they asked. Two things in respiratory infections. Not only respiratory infections, we can call it as comorbidities. Comorbidities means children with have respiratory infections, chronic lung diseases, chronic wheezers, okay, and congenital heart disease, okay, and some kids are that chronic liver disease. Some kids are post transplants, post liver transplants will be there, and some are immunocompromised.
Speaking to someone else.
So some are immunocompromised. Okay,
Right.
some are on drugs. The children, so you need to be very careful from day one itself.
Right. So they need to be in expert care, and I don't think we should be able to answer them right here on these platforms. So
Exactly.
they should be seeing the experts, and Apollo can help you there. And how about the pneumonia vaccine, Dr. Sreedhar?
So pneumonia vaccine, as I told you earlier, we should not postpone any vaccines, especially this period. You need to give that pneumonia vaccine, means pneumococcal vaccines. Two will be there, two will be there. And influenza also, along with influenza. Don't postpone it, especially these two.
Great, great. Thank you so much, Dr. Sreedhar Garu, for joining us today. And I hope you will wait for us. If any more questions, I'll bounce it off to you. Thank you, Andy.
Thank you.
Moving on to Dr. Neethal. Neethal, as you must be knowing, and a lot of audience who are watching this, especially from Andhra, Telangana region, that I'm also isolating. Another 2 more days to complete my 2-week isolation. And my entire team of 12 people are isolating. I was just going through the Apollo Kavach program, which has been beaming on the screen for a long time now. I'm thinking if this program was available for my entire team, I would have been so assured. I would have been so happy. You are on mute, doctor, if you can unmute yourself. And this is so wonderfully designed package, yeah?
Yeah, so Apollo Couch program, we've launched this a couple of months ago, and it's seen a lot of traction of late. Mm-hmm. And we have close to 20 hotels, and we're still going strong through the country, mm-hmm. where we encourage people who wish isolation at home. We can take care of them at home through 24/7 nurses and doctor connects, and also in the hotels. Right? Mm. People who do not wish to stay at home and infect other people.
And also, even if I'm at home or isolation, there's so many questions here. There's so much of everything, as you were saying. If I have a scratch on my back, if I have a rash on my face, if I have a pimple on my cheek, everything becomes like, is it related to COVID? So I want to speak to somebody about this.
Yeah, so we have 24/7 nursing, personnel and doctors who are there available for you. You just have to, check into the program, and we're there for you. And you can talk to a nurse all the time. You can talk to a doctor through a consultation that keeps happening every day. Mm-hmm. And we have a basic package that starts at 300 rupees per day and an advanced package of 600 rupees per day. You can also order a kit, which has a pulse oximeter, your different structures of thermometers and things like that. Yeah. You can just go and check out and see, and that's delivered to your house. And while you're at home, you can use all these things to monitor yourself. Isn't that good?
This is almost like a kavacham antam kada nijanga shield laga. This is guarding us and our health.
Absolutely.
ये देखिए, अगर कोई घर में बैठा हुआ है, उनको बहुत सारा टेंशन हो रहा है कि अकेले बैठे हैं, और मोटिवेशनल एक्टिविटीज भी है.
So we have a list of personnel, health specialists, from doctors to physicians to people who are counselors, rehabilitation experts, dietitian, nutrition and dietitian. So we engulf you with every aspect of health, and it's taken care of while you're isolated.
And while I'm isolating, I have the kit which is available at 5999, and that can be delivered home safely to sanitize.
Absolutely.
And if I need to consult a doctor, if my vitals are coming down, you were saying about oximeter, the pulse oximeter.
Yeah.
Is that very easy, or everybody needs to check, or only are there any parameters for somebody who needs to get
It's very, very, how easy is it for you to check your BP today?
Yeah.
With your digital BP, you just put the cuff around and check, right?
Correct.
Pulse ox is just a couple of seconds. You put your finger into the pulse ox and you just, assess your blood oxygenation. It shows you the saturation. That's so easy. So
yeah. All right. So నా దగ్గర pulse oximeter చేతిలో ఉందండి.
There you have that. Yeah.
I have it. Thank you so much. This is something. ఎంత ఉండాలండి pulse oximeter గురించి నాకు ఇది ఆన్ చేయడము. I think we just have to switch it
on. Yeah.
And I put
your finger there, your index finger preferably.
And that's it.
And within a few seconds, it shows you the oxygenation, which should be around 95 to 98. 100 is always good. But anything less than 90 is a concern.
Acha, for everybody, or is there somebody?
For everybody. You cannot have saturations less than 90%, which means that there's something going on.
Okay.
It's always good to take help.
90% కంటే తక్కువ ఆక్సిజన్ ఉన్నట్టు అనిపిస్తే ఈ చిన్నది 30 సెకండ్లలో చెప్పేస్తుంది. So this is 96. Am I good?
Absolutely. Super.
98 లేదు.
If you're staying in Jubilee Hills, you're already on altitude, so maybe the oxygenation is a little less for you.
Exactly.
I'm just kidding. 96 is fine.
96 is fine, right?
Absolutely fine.
అలా కాదు డాక్టర్ గారు, ఎన్ని అనుమానాలు వస్తాయంటే మొన్న నాకు 98 ఉండింది, ఈ రోజు 96 ఉంది అని అడిగే వాళ్ళు కూడా ఉంటారు. ఎందుకు తగ్గిపోయింది? Do I need to worry about it? అని. So this is very simple, yeah. And also, I think you have a video to be shared.
Yes. I think how to access the video, how to access the pulse ox is a video here. So yeah, here it is for you.
Yeah.
Coronavirus can cause hypoxemia, leading to lower levels of oxygen and may cause breathlessness. Early detection of hypoxemia is essential during the COVID-19 pandemic to avoid critical conditions later. Easily keep a check of your blood oxygen levels at home. Pulse oximeter, easy, convenient and safe.
Thank you, Dr. Neetal, for sharing that.
Pleasure's ours.
Just one question that somebody is asking about Kavach program. I'll take that question with you here, Dr. Neetal. Is the safety kit added in the Kavach program? I don't think.
No, it's a separate kit and you have to order it separately.
Right. So that's interesting, and thank you so much, Dr. Neetal, for all the wonderful.
Pleasure always to help.
Please hold on for a little while. If I need to get back with you with a few more questions, we'll ask you to come back. Okay, so everybody is worried about our health, our medicines. Everybody wants medicines, but you can't step out. But what if Apollo 24/7 brings pharmacy at your convenience, right at your fingertip? This one app is doing everything for you. So let me introduce you to Mr. Arpan Chatterjee, who's Senior Marketing Manager at Apollo Pharmacy. Hello, Arpanji. Good morning. Can you please come on the screen?
Yes. Hey, Jhansi ji. Hi. What a pleasure to see you there. And let me just tell you that I am all ears for everything that you're saying. Very informative discussion.
Thank you so much. And we need more information from you, Arpan. And I'm understanding that Apollo is doing everything through 24/7. Everything is in it. Once the doctor gives me a prescription, I can just touch and get my medicines.
Yes, ma'am. Let me just tell you. Yes, that is actually happening. Apollo 24/7 is bringing to us the power of 4,000 odd Apollo pharmacies to your mobile phone. As you have mentioned, we can just ensure that every medicine that we need will be delivered to our doorstep using this Apollo's 24/7 app.
Okay, that's very, very interesting. So if I'm not prescribed by a doctor of Apollo team or from the app, but still can I get medicines from Apollo 24/7?
Absolutely does not matter. We at Apollo 247, Apollo Hospitals, Apollo Pharmacy, all of us are at the service of the customer. As long as the medicine is a prescription medicine and as long as there is a prescription which is a valid prescription, we will honor the order. And not only that, in couple of cases, we will go a step ahead, and if we have any doubts with the prescriptions, we will even call the customer and take a confirmation on what medicines he exactly needs, along with his daily necessity items also.
Oh. So it's not just the pharmaceutical items, as you said, the daily necessary items which are available through the OTCs are also.
Yes, ma'am, definitely. If you see around me, I have my kavacham. This is my personal kavacham. The hand sanitizer, air freshener, face shield.
And definitely the disinfectant spray.
Definitely, yeah. And the face mask. We will ensure that whether corona is there or not, Apollo Pharmacy's products and service will be there round the clock. We are there for the customer across seasons, across time, across years, across every possible conceivable thing.
Wonderful. And which locations are you serving, and where can I get my medicines delivered?
Yes, madam. Good question. We are there in all the metro cities. These 4,000 odd Apollo pharmacies are there in all the metro cities, not just the metros. There is a huge list of cities. I think customers can go to Apollo Pharmacy's website. There's a store locator. They can locate a store that's nearest to their location. But however, at least in the big metro cities of the top 10 cities of India, we can ensure same-day delivery of medicines. We are there in, coming to the Telugu states, we are there in Hyderabad, Visakhapatnam, Vijayawada, Tirupati, even the tier 2, tier 3 towns also we are there. So we are just a call away. Earlier we were a call away for the customer. Now we are just an app click away for the customer.
Wonderful. And so how long will this delivery take?
Ma'am, at least in Hyderabad, we have come up with a new concept of a 4-hour delivery. So in Hyderabad, if the order is placed within 3 p.m. daily, within afternoon 3 o'clock, we'll ensure a delivery within 4 hours. In other locations, generally we do a same-day delivery if the order hits us before 3 p.m. or 4 p.m. But otherwise also, Apollo has been doing deliveries for the last 15 to 20 years. We have huge expertise and we have a field staff who's absolutely raring to go to the customer's doorstep and get the medicines delivered as soon as possible. But generally, rule of the thumb, 1 day, same day delivery. In city like Hyderabad, we have piloted a 4-hour express delivery. 4-hour delivery if the order hits us within 3 p.m. daily.
Wonderful. Yeah, this is really helpful for people in and around Hyderabad. May you utilize this service. Go on to Apollo 24/7. Just one more question, Arpanji. If I am remotely placed and I need to deliver the medicines to somebody else, for example, my friend stays in Vijayawada, and if she requires to send medicines to her parents in Hyderabad, is that possible?
Definitely, ma'am. I think you are not just a very good anchor, you are also a very good mind reader. This is my situation currently. My parents stay in Kolkata, okay, and I have been using Apollo 247 app to get these medicines delivered to their doorstep in Kolkata. So what I do is, we will be seeing a video, I believe, shortly of how to order medicines. In that, there is an option of having multiple addresses. I can have one address that's mine. I can have a friend's address as well. I can have my parents' address. I can have my grandparents' address as well. So I can ensure sitting here in Hyderabad, I can get the medicines delivered in any of these 4,000 odd locations where Apollo Pharmacy is there.
Okay. So before we move on to the AV or Arpanji, one just question. Which are the areas that we do not serve? There are people who are asking, "Hamare location mein to medicine aata nahi hai." There are 2 or 3 people who are asking here in the live chat.
Coming to the question that locations where we absolutely don't serve, we currently don't have a presence in certain parts of Northeast India. Okay, maybe we have present in Guwahati now. We are not present in certain parts of Kerala, but I'll quickly tell you the cities where we can definitely serve. Hyderabad, Bangalore, Chennai, Mumbai, Pune, Delhi, Kolkata, Jaipur, Lucknow, Vijayawada, Vizag, Mysore, Coimbatore. So if I start saying the name of the cities, I will sound like a waiter in a restaurant giving the menu like idli hai, vada hai, dosa hai.
इतना लंबा लिस्ट मत पढ़िए because अपना time भी बहुत कम है, so we understand that you are a strong 4,000 presence.
Yes.
So let's see a video how to order medicines before I get to the quiz questions. There are 2 more quiz questions, sets of quiz questions coming. So let's see.
Definitely.
Yeah.
So there you see the video on how to order medicines.
Yeah.
There it goes. Step 1, buy medicines. Search the medicine you need. Click on buy now. Then option of adding multiple medicines. Option of uploading prescription. Easy access of prescription from camera. Select the address. Home or office. Address selection done. Multiple payment modes. Click on proceed payment. That's the acknowledgement. So I will very quickly recap. There are 5 steps in this. 5 steps. You first search your medicines, then you add them, then you go to the prescription upload, then you select the address, then you select the payment mode. Simple 5 steps. Buy it, search it, buy it, upload prescription, select the address, click on the payment mode that you need. As simple as that. It is a child's play now to order medicines from Apollo 247 app.
Great, and the 4-hour express delivery.
Delivery, yeah. 4-hour express delivery in Hyderabad will ensure that you get your medicines in a jiffy.
Great. Thank you so much, Arpan, for joining us today. And I now move on to the quiz questions. Come on, guys. The next set of quiz questions are ready. So let me give you the right answers for the first 3 questions. The first question was largest organ in human body. The answer is skin. And let's see who the winner is later in the towards the end of the episode. How many bones are there in the adult human body? The right answer is 206. People who have typed 206, let's see who the winner is towards the end. And the last question I asked in the first round was, how many features are there in Apollo 24/7 app? There are 8 features. So now moving on to set number 2 of quiz. Here are the questions, 4 questions coming up this time. Get ready with your chat box lo answer kottadaniki ready ga undandi. I am checking the chat box as well. First question in set 2. When was smallpox eradicated from the world? Repeating the question, when was smallpox eradicated from the world? Okay, kottastanara, which year? I want the year. Date akkarledandi, year matram kottandi chalu. Guess kottakandi, kavalante Google lo velli chuskochu mari kottandi. Information is power, right? So next question here, quiz question ki ready ga undandi. Which is the most rarest blood group? The most rare blood group. ఏమిటి అనుకుంటున్నారు? ABCD, FG, HI, KLM చెక్ చేయండి, మళ్ళీ గూగుల్ దగ్గరికి వెళ్తారా? వెళ్ళండి, ట్రై చేయండి. సార్ I can see 1952, 1980, 1970, 1998. అనిల్ మట్టు 1998 వరకు స్మాల్ పాక్స్ ఉంటే మనం అందరం ఏమై ఉండేవాళ్ళం అబ్బాయి? No, 1989, 1980. చాలా మంది చెప్తున్నారు. Let us see what is the right answer later. And the last the question number 3 in this. What is the speed of sneeze? తుమ్మితే అది ఎంత వేగంగా వస్తుంది? ఎన్ని miles per hour? What is the speed of a sneeze? How many miles per hour? And the 4th question here, set 2, 4th question. It takes 14 muscles to smile. How many muscles does it take to frown? It takes 14 muscles to smile. How many muscles does it take to frown? నవ్వడానికి 14 muscles కావాలి. చిరాగ్గా ముఖం పెట్టడానికి ఎన్ని మజిల్స్ ఉపయోగపడతాయి? ఆలోచించండి, టైప్ చేయండి. ఓకే, సో దట్స్ ఇట్. 4 questions అడిగేశాను. మీరు నాకు ఆన్సర్లు పంపుతూ ఉండండి. AB నెగటివ్, A నెగటివ్, O నెగటివ్, Bombay blood group. Oh, a lot of people are answering this. Dr. Srujana Deepti 90. ఏమండి డాక్టర్లు కూడా పార్టిసిపేట్ చేస్తున్నారా? Okay, this is interesting. All right guys, let's move on. Keep typing. Give me your answers now. Apollo Clinics Resident Welfare Association అంటే Apollo hospitals ఎక్కడ ఉన్నాయో మన అందరికీ తెలుసు. We have different hospitals across India, but Apollo Clinics is something which specializes giving services at doorsteps of resident welfare associations. Joining me right now is Mr. Bala Subramaniam, who is the business head for Society Clinics, Apollo Clinic. Hello, Mr. Bala. Can you please appear for us on the screen?
Namaste, Andy.
Namaskaram, Bala Garu. This is so interesting that Apollo has clinics at Society Clinics 30. In our session 1, Dr. Sreedhar Garu was telling us that vaccination schedule has to be followed. So do you think that we can continue our child vaccinations safely at Apollo clinics?
Yeah, absolutely, Andy. As Dr. Sreedhar mentioned about not to miss primary vaccines and maybe postponing secondary or booster vaccines. So at all our Apollo clinics, we are offering vaccination program with zero risk factor for the child and the parents who are accompanying the children. So we are not missing on any of the vaccination schedule. So the parents can just book the appointment online with the helpline number available on all the online platforms. And whoever child is getting vaccinated, there is a complimentary consultation for mother, which is absolutely necessary in these COVID times. As I can see, many parents are asking questions for themselves, being a parent, and also for their children.
That's interesting.
So we are offering from newborns to 16-year-old. So all the Apollo clinics have got all the senior consultant pediatricians who are always available and ensuring that no vaccine schedule is missed out.
Balagaru, vaccine schedule is taken care at Apollo Clinic with highest safety and also additional taking care of mothers, you said.
Yeah,
so
absolutely.
How about the fever clinics? What is the specialty of a fever clinic and Society Clinic?
So I think there's a AV coming out on fever clinics. So let's watch the AV, then I will speak about at length on the fever clinics.
Sure, Balagaru. That's it. Yes, Balagaru, thank you so much. I think the video was very, very effective and self-explanatory, not much to talk about it. So what is the Safe Society program that you are, we can see something on the screen?
Yeah. So to talk about the Safe Society program, now during this COVID pandemic, everybody has a fear in their mind. So whichever places they are rushing in, which are places they are moving in. Is this place is safe for me? And
Yeah.
if I'm going back to my residence, how safe I am and how safe my family is. So in order to keep everybody safe and secure in this COVID pandemic, so we are offering to all the societies or residential welfare committees a safe society program where there is safety for everyone, individual, family, the society, and even during the transit times also.
Yep.
So we are offering a screening for individuals, a group screening programs for all maids, housekeeping people, and security, because they come into interaction with many people coming inside the communities. So we are offering screening for everyone, individuals, and there's a safety kit for family, which is the Corona Care Kit, which what Dr. Nital was speaking some time back. So which has all the prerequisites to keep every individual safe and be rest assured and in this particular pandemic situation. And there's a consult handbook also available where every minute details is mentioned on do's and don'ts.
Okay. So, Balagaru, this is very interesting. And how does one reach the society clinics if any resident welfare associations are interested? And that's the last question for you there. Yeah.
So, so currently we are operating at 60 plus locations in all the four metro cities in Hyderabad, Chennai, Bangalore, and Pune. So we are expanding it to Delhi and Mumbai. And if I talk about Hyderabad, since that's a home place for all of us, so we have 26 clinics in major residential welfare associations, and our contacts would be shared with the respective people so they can approach us and enroll for the Safe Society program.
Okay.
So where this is very much essential in this time.
Yeah. Wonderful. Thank you so much, Mr. Bala, for joining us today.
Thank you, and stay safe, stay healthy.
Thank you so much, Andy. Thank you. And with Apollo 24/7 and the Society Clinic, I think we are given the assurance again.
Yeah.
Thank you. And now time to conclude this session. Thank you all the doctors who are doing amazing job in these times and who are always available 24/7, and they are there for a video call. They are Sreedhar Garu, thank you so much for joining us today. There's so many questions that I would want to ask you, Dr. Nital. There are so many questions that everybody's asking about 24/7, but I think it's easier to access you through the app rather than the right here, right in the health tab.
I want to conclude just only one point. So only thing is to all kids, I'm just telling the truth, don't be panic. At the same time, don't be careless. So why means there is no proper treatment. So for only drug control and government of India only suggested 2 drugs that is only for severely affected admitted kids only, not for other drugs. That's why be careful, very careful, and stay safe, stay healthy.
Okay, thank you so much. Stay safe. మీ పిల్లల గురించి ఏం డౌట్ ఉన్నా సరే డాక్టర్ శ్రీధర్ గారిని కన్సల్ట్ చేయాలి అంటే మీరు అపోలో 24/7 యాప్ లోకి వెళ్ళి బుక్ చేసే వారి కన్సల్టేషన్ బుక్ చేయొచ్చు. Am I right, Dr. Nital Garu there?
Absolutely, there's no doubt in that.
Yes. Thank you so much, Dr. Nital and Dr. Sreedhar.
Thank you, Ms Jhansi. Thank you, Dr. Sreedhar.
And now to conclude our show, gifts iవ్వాలి, surprises cheppali, answers cheppali, and also the gift coupons I need to announce. Okay, quickly, I'm thanking each one of you who have joined us in the live session. Andarki thank you andi, మీ టైం ని ఇక్కడ స్పెండ్ చేసినందుకు. అందుకే అపోలో 24/7 ఈ రోజు ఈ లైవ్ లో పార్టిసిపేట్ చేసిన ప్రతి ఒక్కరికి గిఫ్ట్ కూపాన్స్ అందిస్తుంది అండ్ డిస్కౌంట్ కూపన్ అందిస్తుంది. ప్లీజ్ ఎన్ష్యూర్ దట్ యూ యూజ్ దిస్ కూపన్ ఆన్ యువర్ అపోలో 24/7 యాప్. If you don't have the app already, please download. The coupon, the first gift coupon that we are giving everybody is Apollo 247. $299 off on online consultation with Apollo doctors. While you're booking your consultation, there's a column where do you have a coupon code and adugutundi. When there's a coupon there, you please punch in Apollo 247 and there you go, you get a $299 off. The second coupon that we're giving all of viewers today is Medicine 10. This is on Apollo pharmacy orders. Get 10% on pharmacy orders. So this is wonderful. Thank you so much for joining us. Make sure that you use this gift coupon whenever necessary. Hope you stay safe. Download the Apollo 24/7 app to use this. And now to conclude my quiz session. So quiz number 2 lo adigina questions ki answers cheptunnanu. Let's see who all have got the right answers. When was smallpox eradicated? That is in 1980. Congratulations to all who have typed the answer. The rarest blood group is AB negative, and the speed of the sneeze is 100 miles per hour. 14 muscles to smile and how many to frown? That is 43. So people who have answered correctly, Valalonchi, we are giving away prizes to few people, and the lucky winners today are, yes, let me just check where the winners are. Yes. The winner names are, and the winners, you have to be from Hyderabad. Me announcing the winners here does not make you a winner. If you want to claim your prize, you have to write back to us here at marketing@apollo247.com with all your details, and you have to claim your prize, which will be sent to your doorstep. If people have not got their prizes at doorstep, that means that they have not written a mail or they have not claimed their prizes. Okay, so the winners are Anu Vijay, Priyanka Vecha, all videos, Sattu Mahita, Gaurav Mittal, Stali Chowdhury Tummalapalli, Srikala Tatineni. Congratulations to all the winners. Thank you so much for participating. And you have to ensure that you're writing a mail to us. So this is it for this week. Apollo Health Hour is something that we're bringing experts, Apollo 24/7, an entire Apollo range of products to you. So we ensure that we are in connection with you. We keep coming back to you with more such programs, interactive and live programs. Thank you so much for joining, all of you. So hope to see you soon. Bye-bye. Take care of yourself.